Welcome to More Than Words, a podcast about treating the whole child brought to you by the Reading and Language Learning Center. I'm your host, Tristan, and today I'm joined by licensed clinical psychologist, Dr. Sabine Heisman, to discuss the effects of COVID on mental health. Hi, Dr. Heisman. How are you?
Good. How are you? Thank you so much for having me.
Oh, of course. We're doing well here. We're excited to have you here talking all about mental health and COVID. So I just want to have you introduce yourself first. So tell us a little bit about who you are and what you do.
So my name is Sabine Heisman. I am a licensed clinical psychologist. My background is I have worked in all sorts of settings: forensic, rehabilitation, hospitals, private practice, for the federal government, as an adjunct professor at George Mason in the forensic psych department. So I have a lot of experience with working with children, severely mentally ill, kind of the whole spectrum. But right now I really focus on children and children's mental health, and specifically psychoeducational testing. Yeah. So, testing for things like learning disorders, ADHD, autism, emotional health, all of that. That's very critical right now.
Yeah. Wow. That's very cool. I didn't know about the the forensics and the government side of things. That's awesome to hear. I don't remember if you mentioned, but where you said you're at private practice now working with kids. So if people were looking to come find your services, where would they find you?
So Monday through Thursday, I'm at Mindwell Psychology, which we have our office in Chantilly. They do therapy and testing there. And then Fridays, I work for the federal government doing consulting through my company, Cybridge.
Okay, awesome. So I'll link to Mindwell, and if you want to send me a link to Cybridge as well, and I'll put those in the show notes, and people can find you guys there. Well, let's just hop into our first question. So there was a New York Times article that came out a little earlier this year, and it had some research in it showing there's definitely an increase in this sounds broad, but mental health systems after COVID, started. And it referenced that there was about 60%, people are 60% more likely to suffer from mental health problems after COVID than people that did not have COVID. Have you seen this in your experience, in the clinic? Have you had more people come in post?
It's been incredibly overwhelming. There was already a mental health crisis in this country before the pandemic. And, my focus is really kids. And what we know now, and what we're still just getting research on, is that the pandemic had a more severe impact on children and young people who are already struggling with pre-existing conditions, from emotional problems to socioeconomic deprivation. And there has been such a massive increase in mental health issues for, little kids, adolescents, teenagers, adults, so much so that the mental health field cannot keep up. So, you'll find if you need help, you call to get in with a therapist, and it's a 6-month waiting list.
Oh my.
And that is across the country. And so, the system is overwhelmed, and there has been a huge increase in the need for mental health treatment, but there's not enough resources. So the pandemic has definitely exacerbated, the mental health issues, and it's concentrating them in some populations which are already underserved.
Right. Oh, that is honestly heartbreaking. So what symptoms are you seeing when people come in, and is it different between elementary, middle, and high school students?
Yeah, so what's interesting is there was this study, and it was done in 2020, right? The things are so fresh right now. We're still getting research, but what we do know, what the studies, that have been conducted by Children's Hospital is, at least 72% of parents think the pandemic has taken a significant toll on their child's mental health, right? Oh. And if you break that up even further, mental health emergencies rose 24 to 25% in kids 5 to 11, and then 31% in kids 12 to 17. And then that's not even the suicide increase, right? There was about a 45% increase in suicide attempts in emergency room visits with just girls 12 to 17 in 2021. You compare that, to before the pandemic, and there's just these massive increases for kids of both genders, of all ages, and significant increases with more self-harm, more anxiety, more depression. So absolutely, it had a massive impact.
Oof. Wow. That is the numbers are staggering. I didn't realize that. So what should parents be aware of? Like what symptoms, like what behaviors, before obviously they get to an extreme level? What should they be noticing?
Right. And that's what we're trying to get out there to all the parents is, these are the numbers and the, the stats that we have from just 2020. They haven't even done the research for 2021. It's, so we're expecting that the numbers are actually worse. So what we're trying to tell parents is, okay, as a country, as a community, we've gone through a true pandemic that has a severe impact on mental health for everybody, right? Little kids, big kids, adults, parents. And so what do you look out for, right? Because you don't want it to get to a point where you're at the ER. So the big thing is, depending on the age of the child, how to talk to them, right? Because the little ones, the wee ones, sometimes they don't know how they're feeling, how to describe it, right? So, they're feeling frustrated, they're feeling angry, but it could really be that they're scared, right? That they're not understanding what to do or how to describe how they're feeling, right? I mean, they're not going to say, I feel depressed if they're 5, they're going to be angry and acting out. Whereas, a 12 to, 15-year-old might be, they're going introverted, right? They're being more isolated. They're not coming out of the room as much. So to recognize the signs of stress in your child, if they're under 10, I would say to do constant check-ins, right?
Okay.
You want to meet with them daily, right? And you don't want to interrogate them, but you want to say, mom had a rough day today. I felt sad and I felt nervous when, give examples so they understand this is what that means, right? If I felt uncomfortable in my tummy and, I got scared, maybe that's anxiety, right? And so to give them the words and to normalize that, everyone has bad days, even mom and dad and grandma and grandpa, it's okay to talk about it, right? Because the most important thing is to almost keep kind of a daily log of how the little ones are feeling. So you notice, wow, little Timmy was really misbehaving today in school. What was that about, right?
Right.
It could be that, sure, maybe they didn't get enough sleep or, but maybe they're nervous. Maybe they're scared, right? Maybe, I've had a lot of little kids say that they're not comfortable in big spaces where there's a lot of people, like crowds.
Yeah.
And so things like that makes them really nervous. And, knowing that and knowing the situations is really helpful. For the older kids, I find that the teenagers and the preteens, they don't like talking about their feelings as much because it's not cool,
Right.
Not considered cool. So the big thing is, as much as you don't want to be the annoying mom and dad, that's, how you doing? How you feeling? What's going on?
Right.
I find that the more subtle you are with the teenagers, the easier to get them to kind of coax it out.
Yeah.
So I always tell parents, don't do it at the dinner table when they're stressed after a long day,
Right.
Take the dog for a walk, go out for, for some reason nowadays, all the teens love the Starbucks drinks with the, take them out for Starbucks. I'm not saying caffeinate them, but, take them out for a treat, an ice cream or something, and just talk about your day and what's stressing you out as a parent. And then, just natural reciprocity, they'll start talking about their day and opening up, and you might be able to get information kind of indirectly. And it's so important to let them know that the line of communication is open. We are here for you as parents, if you're stressed out, if there's something you're scared of, it's normal because so am I. The pandemic has really stressed out a lot of parents and families. So they need to understand it's normal now, but we're in it as a team. It's a community effort. And if they feel like they're supported and they're not alone, it'll make a big difference in the long run.
Yeah, that's super helpful. I think very important to hear and good to know it's a daily check-in, especially with the little ones. Because I think you almost like take for granted the fact that you like live with your little ones, right? So you think like, oh, I know when they feel this way or that way, but not all the time. So it's good to be reminded you need a daily check-in. It doesn't have to be scary. It can just be, how are you doing today? How was your day? Like, just a regular conversation.
And one of the things that I think that people forget, that parents forget, is at least in this country, over 150,000 kids lost either a parent or a grandparent directly to COVID. So whether it's them or indirectly a friend or a classmate, there are kids that are really struggling with things that, the traumatic deaths of people that they knew, whether it's teachers or friends or neighbors. It's not something that we as a society talk a lot with. We're not really comfortable with death. And so I think a lot of the kids that we've seen are struggling with, what is death? What does that mean? Am I going to die? Am I going to get sick? There's a big increase in anxiety over, health concerns. If I get COVID, am I going to die like, grandma and grandpa or something? And so also talking to your kids about, feeling comfortable with that discussion is so important for the well-being, so that they're not staying up late, worrying about things, that they have somewhere to go, someone to talk to.
Yeah, that's a very good reminder as well. We've had a lot of parents share that their children are anxious about school, or like being in school now, but they weren't anxious about going to school before. So these are kids, that had the time to go to school before COVID happened. So what would you say to a parent that's dealing with an anxious child now after COVID?
And I feel like every single child I've seen fits some kind of criteria for anxiety symptoms where that wasn't the case before, because the kids tend to fall in two categories. The kids who are really nervous about COVID and their health, because they've experienced the traumatic, death of a family or illness. And they're like, they want to wear their mask, but the other kids aren't wearing a mask.
Right.
And so they're like, what if I get made fun of for wearing my mask? Or, what do I do? What if I catch it? And then the other kids, are more comfortable. They don't want to wear the mask. And so then the kids are feeling like there's this divide in the classroom,
right.
And they're nervous about the social interaction and the social pressures. And I said, I don't care what side you're on about the mask debate or anything like that. What matters is making the kids feel comfortable and safe, whether they want to wear a mask or not wear a mask. It's about respecting each other. And that's what I said. Talk to your kids about, everyone's going to have a different view on the pandemic and on COVID and what it means. Just teach your kids to be kind and respectful to whatever's, the choices their classmates make, right? The whole point about this is going back to school and having fun,
Right.
But then you do have some kids where for the pandemic was actually a blessing in disguise for some of them, because some of them were feeling bullied and lost socially, right. And so they're even more nervous about having to go back to that. And so what I keep telling parents is, look, COVID was a game changer for everybody, right? So you talk to your kids about going back to school and saying, we're going to take everything one day at a time so they don't get so stressed. And we're going to check in and we're going to talk to things and we're going to talk to your teacher and we're going to let them know how you're feeling so that you have an ally in the classroom, someone who can check in and you feel comfortable with. And I tell parents, talk to your school counselor. Let them know that your kid might need a little extra check-in here and there.
Yeah.
But I tell parents it's critical for you to relate to the teacher. And, the teachers are stressed themselves. I mean, it's been huge for everybody, but especially our, poor teachers who have been struggling and, have been the heroes in this whole thing. But check in with them and let them know, your son or daughter is really nervous about coming back for whatever reason, whether it's social interactions or academic, they feel like they've fallen behind. Let them know what's going on so that they're aware at the very beginning. So you're not waiting till November or December, when they already feel really lost and frustrated.
Yeah. Very good advice, and good to bring in the school counselor too. I think that sometimes that's a resource that parents forget is there. So that's a very good reminder to us all. So switching over to what you guys do, which is testing for these kids, do you see that this anxiety that's brought up about school and all of that has impacted the testing that you're doing for kids?
So yes and no. So we do a lot of psychoeducational testing, but then we also do emotional and psychological testing, right?
Okay.
So parents to us usually for one or the other, right? So either, your child is struggling academically and you suspect that they may have ADHD or dyslexia, or dysgraphia. And you're trying to get a diagnosis, because most parents don't know this, but the schools really can't diagnose your child with these disorders. And parents get very confused because they come with us and they're like, well, the school tested us and we don't know what's going on. And I'm like, well, they can't give you a medical diagnosis. That's what this is for. And so the parents come and they say, okay, in the pandemic, especially with that year where, a lot of it was virtual, the parents are really seeing one-on-one what their kids can and can't do and what they're struggling with. Yeah. And so we were flooded with calls because we had parents where it's like, my kid cannot read where they're supposed to, and I didn't know, and I'm freaking out. It's like, okay, don't freak out. What we're going to do is we're going to test to see where they are, and we're going to see, do they meet clinical threshold for a learning disorder, right? Okay. And if they do, that's not the end of the world. It's actually good to catch it, because early intervention in general can remediate. If your child can't read and they have dyslexia or something like that, there are treatment options. Right. There are things. My son, couldn't read in kindergarten. He was really struggling, and we actually, used the Reading and Language Learning Center. Yeah. He went from not reading at all in kindergarten, I mean, not even a word, to testing at a 4th grade level. after 10 months.
Oh my gosh.
It was incredible, So, I mean, I always tell parents, don't worry. Learning disorders are everywhere. We just don't see them. They're not diagnosed, but there are treatment options. So we help parents kind of not only diagnose, but navigate what to do next, right? How to remediate.
Right.
And then on the other side, you have the psychological and emotional testing where it's like, okay, my kid is really struggling with anxiety, or they developed OCD from their anxiety from the pandemic, or like many of our high school students, right now there was a survey and it said about 1/3 of high school students are unhappy and depressed. That's a lot, that's a huge number.
Yeah.
But what we're seeing also, unfortunately, is a massive increase in self-harm behavior. So it's like, we do not want it to get there, right?
No.
So we need to make sure that we know, okay, if you have depression, let's diagnose it and let's treat it. Right. So the symptoms of anxiety and depression, they don't usually impact the academic testing.
Okay.
Only when you have anxiety that's so significant, that then it kind of mimics that, I'm so anxious that I can't focus or concentrate, right? And so parents like, is it ADHD or is it anxiety? And it's like, well, that's what we do all the testing for, to really kind of tease it out, right? Because unfortunately, ADHD is also really misdiagnosed, right? I mean, people think it might be hyperactive, they have ADHD, and that is not the case, right? I mean, kids are active. You have to have issues with working memory, with processing speed, with executive functioning. There's a really, visible pattern there of symptoms. And so it's like, okay, anxiety can absolutely impact your attention, right? And your memory, right? And so the whole point of the really, really comprehensive testing is to tease it out, because it could be anxiety, it could be ADHD, it could be both, but one could be exacerbating the other, right? So you see, so I think the testing is really critical. And I think parents sometimes, and I feel so badly for them, they come in and it's like, well, they're hyper and they can't pay attention, but they forget about all the anxiety symptoms that could really be impacting a lot of this. So that's what the testing is for, to really kind of tease out, what are we looking at, and then more importantly, how do we treat it?
Right. Wow. I think my next question for you was like, should parents discuss mental health with their teens? But we touched on that earlier with having the kind of like slow coax out of like, how their day is going. But of course you said have an open conversation, but what would that conversation look like if you like wanted to have a deeper conversation about it, instead of it just being like, how was your day? That kind of a thing.
So I always say, look out for actual symptoms, right? I mean, your child best. If all of a sudden your happy little kid is isolating or not talking as much or not wanting to play, and there's a change, especially for the little ones, the under 10, if you notice a change to their routine, because little ones are creatures of habit, they like to eat, they like to play games, they like to read, they have their whole patterns, If you see changes to that pattern and it's like, wow, little Susie is just not wanting to play anymore the way she used to, or she's not eating as much, or she doesn't want to go to bed, she's scared to go to bed. If you're seeing differences like that, that's when you really kind of start to have a deeper conversation, and you try and say, what's going on? I noticed that maybe you're not playing as much. Are you scared about something? Are you nervous? Are you worried? And trying to see kind of where the triggers are in what areas of their life. Is it social? Is it, schools getting closer and they're getting nervous about they don't feel like they're on the same level with the other kids. For the older kids, it's actually easier, I think, because, once you hit like 12 or 13, teens are teens, they're a special group. And I love my teenagers because, they're not shy about being like, I just don't want to do this, or, I am sad, or I am mad, or I am angry. Like, they are more articulate in their feelings. They may not want to tell you about their feelings, but they can articulate what they're feeling better, So you always know, okay, I feel like this person is maybe having some depressive symptoms, right? They don't want to get out of bed, right? They're sleeping all of a sudden. Now, teenagers sleep, but if your teenager doesn't want to get out of bed and do anything, even the fun things, right? That's something, or if you notice kind of more secretive behavior, or, more anger, more aggressive behavior, these are all changes in a child and of any age. And I think as parents, it's like, you have to be really, really nowadays on top of that, because we are fighting kind of a war with social media and everything. And it's like, it's so easy for the kids to get bad information, from things like YouTube and social media sites. And I don't think parents these days are aware of just how many terrible things are on these platforms.
Right.
that give kids bad ideas about what to do,
Right.
and I always say, really keep in mind what your kid is watching,
Yeah.
because there's a lot of videos out there that tell you how to do self-harm behavior.
Right.
Um, you don't think about that, your kid's
Right.
watching YouTube and Minecraft and it looks all happy, and then, you just don't know. It's a bit of a rabbit hole. And so I always say, really kind of be aware and be present. I know
Mhm.
sometimes kids are frustrating, but if we can be present and set the tone and show them how important self-care is,
Right.
makes such a big difference. But those symptoms, it's like those little changes in your kid's behavior, keep up with those, because that's what's going to tell you, okay, you know what? I think this is more than just, teenage angst, right? I think
Right.
my son or daughter might be depressed, or they might have anxiety. And then intervention, it's not just going to go away. Parents are
Right.
like, oh, I kind of hoped it would go away. When it gets to a certain point, it doesn't just go away. We're talking about a hormone imbalance. We're talking about something that needs therapy, maybe medication, treatment.
Right.
Um, but the earlier you can get it, the better.
Right. Yeah. You mentioned self-care, and I'm interested to know what you might include on like a list of self-care ideas, because everyone's taking care of yourself is different for every single person because everyone's an individual. But um, have you ever suggested to a parent, like, you can do like self-care things with your kid, or like, these are the things I recommend? Anything you have?
So I'm a huge, huge, huge fan of setting the tone in the family, as far as self-care, because I think what happens is we have, especially in the Northern Virginia area, parents are busy, right?
Yeah.
And it's like life goes too fast, so
Yeah.
much faster than anywhere I've ever seen. And we forget, because we're always going, going, going. And, we have to go to basketball practice and soccer practice and music practice and swimming, and it's like at some point your body will stop,
Yeah.
working. It's going to be a problem. Parents are tired, and it leads to all sorts of problems. And so I always say, you know what? Do something amazingly fun with your kids, right?
Yeah.
Like tell them in the morning, we're going to sit down and have a good breakfast together, even if we're a little bit late. We're going to stop and take care of ourselves. We're going to go for a walk. We're going to go have a cup of tea, by the creek or wherever you live. We're just going to sit on a bench and watch the people and just do nothing, and
Yeah.
just stop and be still. What I found with a lot of our patients here is nobody knows how to just be still anymore. We're
Yeah.
always rushing. I'm guilty of it too, but it's, and I have a little boy, and I'm always like, you know what? Let's make a batch of brownies, right? And, let's take it on a walk with our dog, and let's go just, find some flowers and just hang out and, just be still and just have some brownies and milk outside,
Yeah.
just something where it's fun for both of you to just be still. Mindfulness is really great. I do yoga with my son, and
Oh, yeah.
at first, like, this is weird, but you get into it. It becomes something that's like nice. It's challenging and it's fun, and even something that they really like. Whether it's learning a new skill like a cooking class, or even just taking a walk with the dog,
Yeah.
and going on a what do you see? Let's find 10 things. Just slowing things down is
Right.
so important for kids, because they're always on the go. We make them be on the go, right? I mean,
Right.
my son has more activities than I ever did. Um, and sometimes you got to be like, you know what? It's okay to take a day. We're going to take a mental health day. I would do that when he was in school. Sometimes I would take the day
Yeah.
off, and I would say, you're not going to school today. We're going to go
Yeah.
and have an amazing time. We're going to go have a picnic. And he would be like, great. And it would be the best days,
Yeah.
because we're just going to put the brake on and just do self-care.
Yeah. That's awesome. And you mentioned that you did yoga with your son. There
Mm-hmm.
is if you've ever been on YouTube, YouTube has, a mix of good and bad, but there's
Oh, yeah.
one YouTube channel that I really enjoy, Yoga with Adrienne, and she did a couple yoga classes for kids at the beginning of the pandemic that I think are really great.
I actually use her stuff a lot, because I think she's fantastic.
Yeah.
There's a lot of yoga places in this area, like Beloved Yoga, and they do classes for kids,
Oh, I didn't know that.
I mean, as young as like 5 years old. And they're great because
Yeah.
it teaches you kind of self-care techniques that you can do in your room,
Right.
and so sometimes it's like, okay, it's, Tuesday afternoon and we're all cranky. We're going to stop. We're going to do some breathing and some yoga, shake it out,
Right.
you know, change the environment, right? And that's what your brain needs sometimes, is just a complete change and be like, I am so stressed out. Okay, then stop.
Right.
Put the brake on before it gets worse. do something fun, go read a pretty book or do some painting or, have a cup of tea, and it makes such a big difference. It really does. It sounds simple and easy, but it is effective.
Right. Yeah. Oh, that's awesome. Thank you so much for sharing those. I think that was my last question for you, but do you have anything else you want to throw in here?
I would also say, there's, I'm of a Colombian background, right? And so there's one thing I think that we don't talk enough about with mental health in children. And it's that, the research is indicating that children of sort of racial and ethnic minority families have been hit especially hard by the COVID pandemic. And I don't know if a lot of people are really aware of that, but they're up to 4.5 times more at risk for losing a caregiver from COVID just because of the situation. And I always say, I don't think stuff like that is being discussed enough, and we've such a huge increase as well in certain communities. And I think if I could just leave the closing thought of COVID has been really hard and we're all struggling with mental health, but children especially. And the one thing I keep telling parents is, and every single parent that comes to me, talk to your child about being kind, because everyone is stressed and everyone is frustrated. But if we can just focus a little bit more on having conversations with our children about being kind, it will go such a long way with helping with some of the mental health issues, Everyone's coming out of this sort of dark period. We're still scared. We're still worried, we're tired. And so if we just start teaching our kids to be kind and show that kindness to their peers, it will make such a difference,
Oh, yes. I love that piece of advice. It is so incredibly important. And I think if you've ever been having a very good day and you pass that kindness along to someone else, not even realizing it, you'll see a change in another person, even if it's a stranger. So I love that piece of advice. It is.
A little bit of love goes a long way, I think.
Yeah, I agree. Well, thank you so much for being here. Yeah, this has been a joy. And I think it's going to be very, very helpful to all of our parents and other people who are just listening and maybe needed a reminder of take time for yourself. Yeah.
Thank you so much.
Of course. Thank you so much to the audience for listening. Don't forget to subscribe and leave us a little rating and review, and we'll see you next time. Have a great rest of your day.